Well, good afternoon, everyone. Welcome to our March 17th special St. Patrick's Day edition of the State Street Forum. The State Street Forum on Faith and Public Life is co-sponsored by the New York State Council of Churches, and the executive director of the council, Peter Cook, Reverend Peter Cook, is here with us, and the Focus Churches of Albany. And I can see that the executive director of Focus Churches, Fred Bohr, is here with us. And also James Blunt is here with us, who works for Focus and does a lot of the community outreach and political organizing for Focus. So welcome, James. And it's co-sponsored with the Westminster Presbyterian Church, where I serve as the minister. Our goal for these conversations is to connect two worlds that sadly are often disconnected. And that's the world of public advocacy and public policy, and the world of the conversation inside churches that's often about faith and discipleship. And we're trying to to articulate the obvious connections between those two things to help people who are involved with congregations of various kinds throughout New York State to become better public advocates for the issues that impact them and their community. So today we have a really extremely relevant topic for everybody in New York State, but especially for those who are involved with churches. We know firsthand the needs of older people for home health care assistance, sometimes long-term, sometimes just for a short period of time when coming out of a hospital or rehab stay. And then we also know firsthand the struggles of home health care workers who are not paid a living wage in this state. And we're going to hear both about the problem and about the solution today. And I want to welcome all of you to that conversation and turn it over to Peter Cook, who will introduce our speakers.
Very great. Good. Thank you, Heather. And it's always great to work with Heather on how we intersect the congregational life with public policy. And that is a key goal of the New York State Council of Churches. I know of no one better who knows how to make these connections than Ron Deutsch, who is with New Yorkers for Fiscal Fairness. He also used to be the executive director of the Fiscal Policy Institute. And he has just extensive experience in Albany dealing with state budgets and addressing inequality, economic inequality, racial inequality in New York State and also nationally. And so I'm going to invite Ron to share with us some reflections about the economic value, the theory behind investing much more in our home care workers.
Thanks, Peter. It's really a pleasure to be with you here today. I'm a big fan of the State Street Forums, and I am a bigger fan of home care workers, quite honestly. And for the last 7 years, just to let you know about a more personal story, but I've been coordinating my uncle's care, who's 90 years old. He lives in Florida. And I've been coordinating his care for the last 7 years. And my uncle is, I love him, but he is no prize, I will tell you that. And I have seen firsthand just how incredible, literally incredible, the home care workforce is, all over this country. People are just, go out of their way to try and make his life better, even though he is not reciprocating often. And I will say he's a very difficult patient. And I've spent many hours on the phone with home care workers, talking with them and literally apologizing for his behavior. But it's just, I can't thank home care workers enough, quite honestly, because the work they do is just unbelievably important. And just, I don't know of more important work that can be done in our society. So the problem is, though, that we don't value that work enough. And for too long, home care workers have been undervalued and underpaid, and that has to come to an end, right? I mean, we know that the nation's home care workforce has more than doubled in size in the past decade, and that's going to continue as our population continues to age. It is physically and emotionally demanding work. It's got unpredictable hours. And even before the pandemic, the home care field suffered from high turnover and severe labor shortages because of low wages. This workforce is incredible. Fully 91% of the direct care workers are women, nearly 77% are women of color. And despite these important contributions to long-term care and the broader economy, economic self-sufficiency remains elusive for many of these workers who are, have a median wage of about $21,000 here in New York. And as a direct result of that, right, 45% of the state's direct care workers live in or near poverty, so below 200% of the federal poverty level, and 51% actually qualify for public assistance, which to me is completely immoral and should never be the case. Home care workers should be paid commensurate with the value of the work that they are doing. So, while the demand has grown in recent decades, the pandemic has really kind of widened the gap between those who need home care and the available supply of workers. And we could see the need for up to 1 million job positions in New York, according to a recent study by the City University of New York on the need to fill these home care vacancies over the next decade between 2022 and 2032. So, raising wages is really an effective strategy for resolving this home care shortage, and higher wages would reduce turnover, attract new workers to the field, and create large-scale economic benefits for New York State. So Peter and I recently worked on something where we talked about home care as economic development, right? Right now, we view things like building a Buffalo Bills stadium, giving $1 billion to a billionaire to build a stadium as economic development. That to me is, the height of hypocrisy. And, we should be giving that $1 billion to home care workers, not a billionaire. It makes no sense whatsoever. But, that same CUNY analysis estimated the cost and benefits of the Fair Pay for Home Care wage legislation, right? And that legislation would basically increase home care workers' wages to 150% of the highest minimum wage in each of the state's regions, right? So that would be $22.50 for upstate New York, which currently has a minimum wage of $13.20. Unless, of course, you work in fast food, right? If you work at McDonald's or Wendy's, you are getting paid $15 an hour now. So, and that's not to denigrate people who work at, McDonald's or Wendy's at all, admirable jobs, but I don't think they can be compared to the work of home care. It's just not comparable, so I think the other thing to think about is the total federal and state cost of this change, including both wages and payroll taxes, would amount to about $1.3 billion for the first fiscal year in 2023, a part year, and then $5 billion when fully implemented. But the federal government is going to cover about 50% of those costs. So this year, only New York would only be responsible for about $630 million in the upcoming budget. And then in following years, it would only be, I shouldn't say only, but it would be about $2.5 billion. So, if we were to contribute that $630 million this year, it would yield savings, revenue, and economic activity of about $1.7 billion. So the state is going to net more than $1 billion in benefits by doing this, right? And those benefits fall into like 3 categories. So Due to higher wages, the state would receive new revenue via income and sales taxes and would share in the savings that result from reduced public assistance expenditures. These gains total over $1 billion in the first year. And then also raising wages would also reduce turnover and increase productivity among home care workers. And this would produce projected about $2 billion in savings in the first full year. So, you know, higher wages will also stimulate economic activity in the state. And it's estimated that, you know, at 5.6 billion in the first year would be the economic activity that results from these investments. So, you know, overall, the state would see net gains of about $6.3 billion over year to year as a result of implementing this legislation. So it's like, you know, why wouldn't we do this, right? It meets a public demand, it creates economic activity, and we would know that our loved ones are being cared for, you know, by people that are getting a living wage. And, you know, it's long past time that we do that. So, you know, the problem is that what's being proposed, at least by the governor, right, were these kind of one-time bonuses. And that's not going to address the home care shortage, right? Unlike permanent wage increases, a bonus is just it's a one-time payment, and it would have a minimal impact on reducing turnover and increasing productivity. And it would also have very little impact on recruiting new workers to end this home care shortage, right? So one-time bonuses would also not create the economic benefits that we just talked about. So, you know, as we look at this and as we study this, and, you know, granted, you know, I'm a policy wonk and I'm talking a lot about the economics of this, but this is, you know, our human infrastructure in New York State. Much like we can't exist without our physical infrastructure, our roads and bridges, we can't exist without our human infrastructure, right? We need people to be able to take care of our loved ones in their homes. Prevents them from spending their final days or their time in nursing homes or, you know, institutions. Who does not want to be at home, right? People want to be at home. And certainly, you know, our loved ones deserve that. And the folks caring for them and doing, you know, in my opinion, God's work, you know, need and deserve to be paid a living wage. So I'll stop there.
Great. Well, thank you, Ron. As I'm fond of saying, what home care workers don't need a tip, they need a permanent wage increase. And I also think that we, as a state, are evolving in our thinking about what is economic development. And we're kind of trying to shed ourselves of this neoliberal approach of offering tax cuts at the top and thinking that that's going to trickle down to the bottom. And in fact, it's the other way around. We are much better off economically and socially if we invest in our workers, in our people, which generates much more economic activity than a tax break, and also I would say tax revenue to the state of New York. So I'm now pleased to introduce to you Rona Shapiro, who is with SEIU 1199. You know, we're big fans of SEIU. We, as a Council of Churches, have supported labor unions since our inception in the late 19th century. And SEIU is just completely on the front line of advocating for home care workers. And Rona is an eloquent advocate. And so she's going to share some reflections on where we are currently with this legislation.
Rona, you're muted, and would you like to start off with the video that you sent?
No, let me do a little speaking first so that puts in context. So first of all, I would like to thank Reverend Cook and all of you for inviting us to this meeting. I think there is a lot of interaction with your congregations and home care workers. Either they take clients to the church or synagogue. They're probably the most knowledgeable about everybody's religion because they go to Jewish temples, they go to imams, wherever their clients go to pray, they are with them. And then they go to your congregation as participants. So I think there is a lot of interaction, and that you actually probably are with home care workers much more than others have that kind of intimate contact. So we represent over 55,000 home care workers, healthcare heroes throughout the state of New York. We represent home health aides such as Tracy. We represent personal assistants who take care of consumers with severe disabilities. And so this fight is really about those who care for others and those who need care, because New York State has been severely lacking in really paying attention to the crisis, the shortage of home care workers, which began a few years, but has since COVID has really decimated the home care industry. And there are thousands of consumers, thousands of clients throughout the state that cannot find a home care worker. And there are many, many home care workers who can't afford to be home care workers. And you can hear from Tracy, or you can hear from Lilith Clacken, who love their jobs, but they can't pay their rent on love. The landlord doesn't give them a discount because they love their clients. And so we're in a fight to, number one, as Ron said, and Ron took a lot of my speech, but to show that New York State is a caring state that believes that home care workers should have a living wage because they're taking care of the most vulnerable among us, our loved ones. And I love Ron's analogy, or was Reverend Cook, about the governor giving whatever amount of money to build a stadium, but they can't give the money to the home care workers so they can have a better life. It's just outrageous. And I also want to thank Reverend Cook, because we have had a lot of participation. We had Faith for Fair Pay for Home Care Workers. We had over 350 clergy from around the state sign a card, which unfortunately I missed, but Reverend Cook led the delegation to give it to the governor. And so we continue to make it a moral issue. We have a lot of support in the legislature from both the Senate and the Assembly. Both passed one House bills that included the money we need for fair pay. And now it's on the governor's desk. And I wish the first woman governor only good things to happen, to have a woman in leadership who understands these issues. So I am hopeful that she will hear our cries, our pleas, some of us getting pretty angry because the workers continue to work, and then she offers a bonus. So listen, we'll take a bonus. Take us, the home care workers never got hazard pay, and we'll take the bonus, we'll take hazard pay, but Tracy needs a permanent raise that enables her to have a middle-class life, just like many other healthcare professionals. So we are in this to win. We are in this. We had a rally that was fabulous. Tuesday, we took over the $1 Million Staircase, and we had Speaker Hasty, we had Andrew Stewart Cousins, we had the power that's going to negotiate with the governor. So we are asking all our faith leaders, especially if you live in Albany, because you can just go visit them all the time, and tell the governor, have a heart. pay home care workers a living wage so they can take care of our loved ones. Because there are many consumers that they can't get out of their bed without a home care worker. They can't go to the bathroom without a home care worker. They can't get back in their bed without a home care worker. And it's really life and death for a lot of our citizens in New York. This is not about a home care worker sitting on a couch. This is about a grown, mostly grown woman really making a difference in the lives of the people they take care of. So we have done a very expensive ad campaign. We have turned our focus from the legislators who have shown so much support to the governor. So I would like to show the video, and then I would like to introduce Tracy. And I'm just inspired and honored to be able to work with women like Tracy and Lilith for the last 40 years. I must be like 110 by now, but here. Oh, no, no sound. We need the sound.
We'll try again.
Okay.
Today I'm able to stay in my home because of home care. It gives me my life, my freedom.
When COVID hit, we show up every day to keep our clients safe, but we cannot survive on what Medicaid pays home care workers.
Because of low wages, New York has a massive shortage of home care workers. Thankfully, the state legislature just voted for a permanent wage increase. Now it's up to Governor Hochul.
We need the governor to give home care workers a permanent raise.
Okay, that's going on the wave. So we did meet with the governor on Monday, Caring Majority and ourselves and Consumer Directed Programs of New York. And basically she said about the bonus, well, I thought I was doing a nice thing. So it's not a nice thing when workers can't buy food for their families. That's not a nice thing. So anyway, I would like to turn it over to Tracy M. Patterson, who is just one of the 55,000 home care, healthcare heroes that is my honor to work with and represent. So Tracy.
Thank you, Rona. Thank you for always your great leadership, your support. So good afternoon, everyone. Reverend Cook, thank you again. It's always a great pleasure to see you, and thank you for your support. It's Heather, Ron, everyone. So let me introduce myself to you. My name is Tracy Ann Patterson. I am a home health aide, and I am a member of 1199. But first and foremost, I'm a mother of 3. One of them is special needs. I love being a home care. I love it. I love it. You can't explain it. You have to be a home care worker to explain it. But doing this job, okay, we live in New York. So when you live in New York, as home care workers, you tend to work in every borough. You're not based in the Bronx, Brooklyn, and Queens. So even though I live in Queens, I can end up in Brooklyn today, the Bronx tomorrow. And sometimes that takes up to 2 or more hours just to get to a client home. So that's the travel on public transportation, bus, multiple trains, and another bus, and distant walking. When we do, we don't know what we're going to expect, but we go. We take care of the most vulnerable, disabled, elderly, and the sick. We make sure they're fed. We make sure that they take their medication on time because that's essential to keeping them here. Personal hygiene. We talk to them, help schedule doctor's appointments. We are family, even if we're family. And doing that, I struggle to pay my rent and my fellow homemade aide. It's hard for us to go to a job and we can't even buy a Metro card sometimes. We can't put food on the table. You're telling home in the pandemic when everyone was able to be at home, we were going to everyone home without PPE. And it's scared to come back to our own family that we had to say, go inside and hide. Let me run to the bathroom, try to do every precautions. but we knew that we had to go because they live alone. Some have no family. And it's essential that we go there to make sure that they're okay, because we would want the same for ourselves. But when you work sometimes 30 hours and you times that by 15, and you're not able to buy food, over 40% of us live in poverty. That means we are either in Section 8, we are either on food stamps, every benefit you can think of, but yet still we have a job. Majority of us are women of color. I personally was born in Jamaica. I've been here 30 odd years. I am a citizen of this country. You're telling me that I should get up each and every day and take care of somebody. But in my mind, I don't know if I'm going to be able to pay this bill today. I don't make enough to cover my rent. But I still have to provide for the 3 humans that I have. I still have to make sure that my daughter finished getting her college education. I still have to make sure that my autistic son is okay. I still have to make sure that my other son is okay. We love this job. Sometimes I bring food to my patient's home. I go stand on the line for the pantry and bring them food because they themselves sometimes struggle. We could tell you that a couple of us, where if we go to a patient and God forbid they pass away and the family don't want the chucks or the diapers, we call each other. Does your patient need chucks? Does your patient need diapers? That's what we do to make sure that we take care of them, because sometimes they don't have no family or their family live out of state. Sometimes they deserve more hours, but we know we can't give them the more hours. So we even stay after our time. So if sometimes I'm supposed to leave at 3, I'm there to 4:30, 5 o'clock. I know I'm not getting paid, but I don't want to leave them because I know I'm not coming back for 2 days. So I got to make sure that I make some food. Okay, you got to make sure you take this out and warm this up. There's some lunch right here. There's some this right here. I got to call them on the phone. Did you eat? Did you take your medicine? Because we love to do this job. But I don't think that if you can hear that Amazon will pay their workers $17 to $20 per hour, Target is now willing to pay their workers up to $24. I'm not saying retail is bad, but imagine that you're making sure somebody has their medication, goes to their doctor, being fed, home is clean, their personal hygiene is met, and you are saying to us that we are only worth $15 per hour.
Yeah.
A lot of us are elderly. How do we get people to want to come and do this job when they know taking this job on will not be able to support your family? How do I tell people this is a good job to do? This is graceful. This is humanity's finest. And to know that if they take this job, they can't take care of themselves or their children. How could I say that with a straight face?
Mhm.
How do you get up every morning and go to work? Have a job. In 2022, you have a job and you can't buy food. You have a job and you can't pay rent. What are you saying to many of us? People are leaving to go do retail. They don't want to do retail. They want to take care of their patients. But we can't survive this way. It's heartbreaking when we have to sometimes show us a smile, and everybody goes through everything. There's nothing in life is perfect. I can tell you that sometimes I have to leave out my house 7 o'clock to go take a case on in Crown Heights, and I live in Flushing, to be there at 9, and leave that case at 1 o'clock and take an hour again transportation to go take another 4-hour case, just to try to make ends meet, and then take a 2-hour trip from the bottom of Brooklyn back to Flushing, Queens. I can tell you that I worked 6 days last week and I didn't make 30 hours. And then because of that, now we have to work 130 hours for us to have medical benefits. So can you imagine? We're taking care and we can't even get medical benefit. Our funding comes through Medicaid. When you look in the streets, there's new building going up, every infrastructure is going up, everything gets approved. You don't even think twice. but to take care of women and minority women so we could be on a good medium plateau is a very difficult thing to live with here.
Yeah.
For women of color to be able to live a good life is the most difficult task. Doing one of the most freely given tasks.
Yeah.
It is heartbreaking. We love this job. I don't know how to explain and share to people that we love doing this job.
Tracy, thank you for for sharing your very powerful perspective. I'm a pastor and have home health care workers in my congregation, as well as people who receive home health care. And I have to confess that until this campaign started, I didn't know how low the wage was for home health care workers. Let's face it, it's not something that we necessarily ask each other. So how much do you make per hour? That's not a conversation starter, even when you're talking to your pastor. But once this campaign started, I did ask. And then I also asked, there's one individual in our congregation who self-pays for home health care. She doesn't qualify for the Medicaid assistance. She doesn't have a lot of money, but she is spending down the money that she has, hiring her own home health care. And I asked that worker how much they made. This is a private pay home health aid. And she said that for private pay, it starts at $25 an hour. So that's in Albany. But that adds to the dilemma even there. So in other words, an identical job, forget going to Target, an identical job working for more privileged clients, and you can double your salary.
Yes.
So, and it's not even, I mean, a lot of people qualify for the Medicaid. It's not just people who are in deep poverty. There's a lot of seniors who do qualify and disabled folks who qualify for the Medicaid assistance. We want to be sure that we have time to open it up and to have a conversation about this topic. And I'd
Heather,
like to invite, yeah, go ahead.
why don't you show the video?
Oh, okay. If you'd like, I made a video with two members of the Westminster Presbyterian Church who are home health workers. And I was explaining to Tracy before we started that they have not been working with 1199 and have not had the practice of, standing up and speaking loud. But for both of them, this is their first time speaking publicly about their jobs. And at State Street Forum, we often try to have both a policy perspective and a faith perspective. And I'd like to offer this. I know many of you on this call come to this conversation from a faith perspective. And Tracy, I can hear in your testimony just the heart that you have. And in my world, we call that a sense of call to the kind of work that you do. And we recognize that this isn't just a hobby for you, that this is a calling. And that's very important that we support and recognize that. And I hope you'll hear in this short video that these two people I talked to also have that sense of calling about their work, because I did ask both of them, given that you make so little, why do you keep doing it? And both of them didn't have to think twice before they answered. So it's just a short video, and I'll share it with you now.
My name is Eva Manasam. I work with all metro healthcare. I earn $12.60 an hour. At times I work 50 hours, at times 60, at times 40. You cook for the aid, you sweep, you did there or him. At times you feed him or her, you give her bills. At times, other some people know they do it by themselves. Also, others too, you can do it for them. You make their bed. You can take them to appointments, sweep. Yeah. Oh, I love the job because I'm looking for old elderly people. I like it.
Yeah, I'm Daniel Sowaminsa. Yeah, I work as home health aide at All Metro. They pay me $12.75 per hour, which is too low. They started paying $13.50 and then $13.20 since January. But this is too low. I feel it's too low because at the moment I have 2 kids in college, 2 in elementary school, which is too low. If they are paying 20 per hour or 25 per hour, I think it will be okay. It will help a lot of people. Yeah. First, I was working 9 to 11, and then I changed it to now I work 9 to 9, 12 hours. So the whole day you'll be there working. Yeah. When the person is going to hospital, going for checkup, whatever it will go with the person. Yeah, you have to go with the person and come back with it. You have to work more hours because the pay is low. You have to work more hours before you get at least something substantial. See, you have to wake up early in the morning. You don't even see your child going to school. You have to leave them before you go. You come there asleep. At times 3 days, you don't even see your children. You wake up early, you go. You come late, 11 or 12 something. At times when they pick you, the task will go and pick some people and pick people around. You get home around 1. In the morning, 8 o'clock, you wake up, you be going. You come, the children are asleep. Because it doesn't make you a good parent. You got 3 days, you are not seeing your children. Yeah. It's very difficult. Yes, at times when you go, maybe you are looking at a man. The wife is there, the wife will be giving just difficulties and all those things. Or when you go and look at a woman, the man will be giving difficulties. When you go and people you are not taking care of are in the house, at times they give you difficult situations. I was taking care of a certain man, South Albany. We have this elementary school where you'll be shouting, screaming in the house. You don't have anything to say. There's nothing for you to. You'll be shouting, that's the house. At that time, they insult you and the rest. Yeah. Yes, you feel like helping the people that they need help. So as they need help, you're also helping them. Like the pay should go up a little. You see? You think about that faith, like you want to help people, but they also should help you. But they don't do that. You see?
And I got to change that, Rona, to say not ask
Can a
your.
company make the
Whoops.
planet a better place? What if it's a company that's pursuing 100% renewable energy in our operations?
Sorry about that, but I got to change that from ask your legislator to ask the governor now, or demand that the governor. But thank you for giving them their moment to testify. Both Eva and Daniel are just terrific people of faith. And I don't know if you could hear Eva, who's very soft-spoken, but she said, both of them, Tracy, you were talking about your struggle to meet 40 hours. That's not their struggle. Their struggle is that they work 50 to 60 hours because the wage is low. That's another aspect of a low wage job, is to work many, many, many more hours in order to get, the wage that they need to pay their rent, et cetera.
So I would
Also,
Tracy,
Where
Tracy.
they live. Oh, go ahead.
I just wanted to make a point. So, not every agency is similar. So we represent the workers at Old Metro in New York. Up here, they're non-union. And, the minimum wage up here is $13.20, but because there's such low density among the union home care workers, they don't have a voice. And I guess you are going to be their voice until they find the union. But at Old Metro in New York, the workers make $15. They have healthcare, they have pensions, they have days off, and they have a union to speak to them. So I would love to talk to Daniel. I was super impressed with him. And he sounds like he also could be a leader up here for the home care workers. We also have Ms. Clacken here. She was in the video. I don't know if you would like to she's famous, but if she's been trying to get on for like a half an hour. So it's your show, Reverend. So whatever you would like to do.
Yeah, no, welcome, Lilith, and thanks for coming, and thank you for, we're glad to be here for the debut, the red carpet of that performance there. It was, it's a terrific ad, and you're just very beautiful. So would you like to share a word or two? You can unmute yourself if you'd like to.
Well, first of all, I want to thank you and the patience that Rona and you have exhibited. But I really, really know that I represent so many of us. So it's always a pleasure to do what I do. I enjoy, as usual, I would tell you, I enjoy doing what I do. But I am so grateful for those who help us advocate, because without this advocacy, we would not get what we deserve. So it's always a pleasure. And I can't begin to thank the clergy. I can't begin to thank so many of you who have stood by our side, because you know what we do and we like what we do, but we really, really want to live in dignity just like anyone else, as well as taking care of our consumers and our patients. I can't stop bigging up my VP Rona, my Union 1199, and more kudos to my aides, my colleagues, the people who do the hard work, the invisible, even though we know that we are visible. Thank you so much. And I was listening in. I was just not able to join you because I'm at the hospital with my patient, and that comes first. So in the hospital, it's very, very difficult to actually get access. So thank you so very much.
Thank you, Lilith. It's wonderful to have you here. Let's get some questions. If you have a question, please unmute yourself and go ahead and ask, or you can raise your hand, or you can put it in the chat, whatever way is comfortable for you. And if nobody has a question, I certainly have one. And I don't know, Lilith, if you're still able to respond, but Tracy, I'd also love to hear your response to this. But do you feel that with, Tracy, I hope it's not too personal of a question, but do you have a connection to a faith community? And do you feel like there has been a way in which you can, that in general, in your church or whatever you're a part of, that people understand the sort of struggle of the home health aides? Or do you feel like it's something that in general in congregations, it's not understood?
I feel it's understood because the congregation is members of myself and other different. So it's understood. Like you said earlier before, I don't think we have discussed with one another the actual wages. You know what we do, everybody know what each other do, but we have never been in more detail as we are now because of the pandemic. It opened up to so many different things that everyone is now okay to say, you know, and I'm struggling. So it's understood. We're just speaking up more. Before we were a little ashamed to say we make $15, you know, so we kept it to ourselves. Now we are more vocal, like we're struggling. This is what we do. We need support. So they understood.
This is Neil Berry. Could I ask you a question?
Sure.
What do other states do? Are there other legislation around home health care in other states? And have they passed any bills or laws that we can reference to?
Well, that's what we're working on. We did introduce 2 bills for the Senate and the Assembly. I think Rona has the bill number. I know it's don't have it on me, but I do know the bill, but that's the bill that we're working on for fair pay for home care. You could also go to fairpayforhomecareworkers.org and you can see a lot more about that and how you and your friends and your family can help support us by putting your name, and you could email the legislator, you can call our assemblymen and our senators. So that's one way you can get a good feedback about what was going on. Fair pay for home care work. Oh, there they go. There goes the bill numbers, because I knew the assembly one. So fair
And do
pay.
you know who's sponsoring the bills? Who's the lead sponsor?
Senator May, Senator Gustavo, Assemblyman Richard Godfrey.
Oh, you got good people, so that
Yeah.
sounds good. All right, thank you.
But also, we were fighting, and we keep hope alive, Build Back
Yeah.
Better, because
Right.
President Biden, for the first time, really any president, was putting like $500 billion into home care services. But thanks to our Republican colleagues and a few of our Democratic, that has been stalled. But that was what we were looking for to really make the difference.
But it's in the budget, am I right?
No, it's not in the budget. Not
It's
in
not
Washington
in state-
DC. Not in Washington DC. It's stalled.
No, I mean, I was talking to Tracy. Is it in the budget in the state, in Governor Hochul's budget? I
No.
just don't know.
It's not in her budget, but the assembly,
wow.
they have it. That's why that's
Wow, okay, I
These
got
are-
you.
focus right now. Yes, sir.
The
Thank you.
only thing in her budget was a bonus that most of the home care workers probably wouldn't have gotten, because you had to work a certain amount of hours. And so,
Let me invite Louis to ask his question. Oh, would you unmute?
Thank you. It's more of a statement.
Okay.
I'm this clerk of session for the Church of Gethsemane Presbyterian Church, USA. And I myself have a home health aide. I was paralyzed 2.5 years ago. And I'm making a comeback through the grace of God. I just asked my healthcare worker how much she made an hour, and I was unaware of what was going on until I read Peter Cook's email this morning and said, let me sign on and see what's going on. And to hear what's going on, and to find out from her how much she's making an hour is really, really saddening to hear. But I definitely will ask my legislators to sign on this bill, and you definitely have my support on that. And I thank you, Reverend Cook, for sending out that email this morning. I saw it just in the nick of time to join in. But thank you it was very, very enlightening. I could say for the first time yesterday, being that I got approved for accessoride, I was able to go to my church, which has been damaged by Hurricane Henry, but they're getting ready to do some repairs next week. So I wanted to be able to be with them for the first time in 3 years. Everything has been done by Zoom. And I thank God for Zoom. Technology was right there to help us keep in contact with one another. But in closing, you guys definitely have my support. Thank you.
can I ask where your church is?
We're in Park Slope, Brooklyn.
Oh, I heard. of
We have a
Brooklyn.
specialized ministry in dealing with people who are incarcerated.
Oh.
I'm also part of the New York State Coalition for Restoring the Vote for Everybody.
Wow, nice to meet you. Good
Same
work.
here. Thank you.
But let's get our action item as clear as possible, and then I'll turn it over to you, Fred. But my understanding is that, Louis said, I'm going to be in contact with my legislator. My understanding is, do I have this wrong, that at this point, this has been included in budgets that have been passed by both houses of the New York legislature.
Yes.
So now what we all need to be doing is calling the governor.
Yes, absolutely.
Yes. Okay, Fred, turn it over to you.
Yeah, thanks so much, Heather. Thank you, Tracy and Lilith and Rana and Ron and everyone who shared. Really appreciate this. So I'm with Focus Churches. We're right downtown Albany. And so I know someone who's been involved in the local peace and justice community for about 30 years and is in need of a home health aide. They live outside of Troy in a rural area, and the agency they have trying to assist them would pay a home health aide $14.20. And this person is unable to find a home health aide to assist them. Part of it is because of the low wage. Part of it is because of the red tape and the application process. And some of that application process is to make sure to protect people they're serving, and that makes sense. But some of it is, red tape. And the other part of it too is it's a low wage for people who many of whom may be relying on public transportation. And this is someone who lives in a rural area, and there is no public bus going to where this person lives. And so to be able to access him would mean you'd need a car, which means your cost of living goes up in terms of operating a car and paying for insurance and registration and all that stuff. So so I'm just sharing that as something that I know I've been trying to help find this coworker, this colleague who works for Justice, to try to be able to get the home health support that he needs, and to realize that he himself wishes he could, afford to pay home health aides a living wage and a just wage. I was going to ask, I guess what Heather had just shared, which is kind of what our message should be, very specific. So in terms of individuals or congregations or groups that want to advocate and to sort of jump on board and amplify your voices, Tracy and Lilith, I guess we're going to be directing that to Governor Hochul. And
Yes.
I don't know if like SEIU has like a sample petition or sample letters for either individuals to send or for groups, like a faith community, for example, that could send out. But I know sometimes it's helpful in spreading the word is to already have sort of like a suggested script. I know that helps a lot of folks out, whether it's making a phone call or sending a letter.
Reverend, do you think that you could send out the letter that the clergy all signed? The 300 clergy signed across the state to share with everyone on this phone call? I think that the message we want to get across is pass fair pay in your budget, put fair pay in your budget. Give home care workers a permanent raise, take care of those who give care and take care of those New Yorkers who need care. And there's a lot of money in this year's budget. And that's why we're not backing down. There's a surplus. The state got millions and billions. I don't even know how many zeros from the federal government. And it's time to invest that in care. So whatever you can do, and I do think you have a special voice in Albany. If you all want to go ask the governor for a meeting, take your faith leaders and try and do that. I think the more that people just push her, and the more she understands that this is not just an issue for home care workers, which it would be and should be important enough. This is an issue for people who need care, like your friend or your colleague who can't get care. And they can't get care in Long Island, can't get care in Westchester, and New York City. A lot of workers are afraid to go on their trains. There's public transportation, but it's scary times on the subways in New York due to all the other issues going on and how, So I think whatever message, whatever you could do from your own congregation, and we did ask to, because it's, I'm not disagreeing with what Tracy said, but there's a lot of congregations who know nothing about home care workers. And even though they look at them, and to be honest, I'm not gonna mention the denomination, but we wanted to have press conference on some of the biggest churches in New York just to show the power of the clergy and the moral imperative that you all have. We couldn't get it because of the bureaucracy, because it wasn't an issue, you know, and I think that's really unfortunate. And so whatever you could do in Albany, Brooklyn, we take you in Brooklyn too, Louis, but you know, you're in, so whatever more you can do, it would be so appreciated. We only have 2 more weeks. So
Yeah.
whatever you're gonna have to do. And if there's anything I could do, Fred, to help you with your friend, let me know.
Okay, so James, I see James put a comment in the chat. Would you like to speak out, or are you good, James? Okay, we're coming up on the end of our time together, and we always try to end with action steps. And I think very clearly, thank you, Rona, we have our direct action steps about who to contact and how to contact them. But since we have someone who's obviously a terrific organizer on the line, and or someone's plural, let's just be clear that this is not just to respond to this crisis. We don't need to just be advocates. We need to be organizers. And so when we're talking about 300 faith leaders signed on to a letter, that's a great thing. I'm glad that they did. But we also want to make sure that everybody who's involved with the faith community, so often that's the place where we firsthand come to understand the need for home health care if we ourselves are neither a worker nor a recipient of home health care. When we're in a congregation, we meet people who there are elderly people in every single one of the congregations in this great state. And in that situation, there is always somebody who is receiving home health care. And if that story that, you know, if there's people in that congregation who love that person, just like you, Louis, I'm sure you got people who love you in that church, then they will fight for you. And that means that they're going to advocate that your home health aide has a living wage. So we advocate for the workers, but we also advocate for the people who so desperately need that assistance, who will not be able to get it, as Fred said, if a living wage is not part of the package. And then with the living wage, then we got to get Rona on the job and make sure everybody also has time off benefits and all of that other stuff.
Union, $11.99, not just a union, $11.99.
Yeah, $11.99. We got it. Peter, any closing words?
You're on mute.
So, Rona, I think we could talk a little bit about follow-up with the clergy letter and also, you know, appropriate congregations that might, you know, put this into the public conversation. I'm not sure which ones you talk to, but maybe we could put our heads together here. So
St. Patrick's.
Okay, yeah, let's
A big kahuna.
Okay, and let me just be,
no, that's fine. I appreciate that. Thank you. So what we should work on that. But really, I really want to urge the governor to adopt what the Senate and the Assembly have proposed and build that into the final budget. And we really call on Governor Hochul to do that. And I'm just so grateful for these stories that were shared with us by both home care workers, people like Tracy, and also those who receive this care and how important it is to them. So we're really grateful for your time with all of us, and let's go to work.
Let's go to work. 2 more
We
weeks.
got 2 weeks, 2 weeks. Thank you so much.
And I want to say a real thank you to Ron Deutsch also, who always sets it into the big picture. And I'm going to remember the billions for the stadium.
Yeah, that's a good one.
There's got to be a little coming towards the people who are doing the most direct and essential work in our community. Thank you all very much. Happy St. Patrick's Day. A blessing on all of you.
Yes.
And
And on you too. We
we'll
really
see you
appreciate
then.
you. We really appreciate you.
Take care.
Great, thank you.